Hello viewers, please subscribe the channel, like the video and share it. Viewer, with the right kidney normal, size normal, texture is normal, but on the left side there is grossly hydronephrotic kidney with very thin rim of cortex present. It has converted into the cystic mass, separated. No viable kidney tissues are visible. Grossly hydronephrotic left kidney, diabetic patient, hypertensive. Spleen is normal, size is normal. Left kidney is having very little rim of the cortex available. See this cortex. Whole of the kidney is converted into cystic mass, while the right kidney is normal. Okay. 25-year-old male with pain left lumbar region and heavily distended hydronephrotic left kidney with the hydropelvis. See, the pelvis is hydro, and multiple calculi or concretions within the kidney on left side. Spleen appears to be normal. One of 5 millimeter. Kidney is hydronephrotic with hydropelvis. Size of the kidney is increased. That is 11 centimeter into 6.4. Multiple concretions within the kidney. See the concretions. Pelvic glacial system are distended. See this, giving the hyperepic shadows. Saal ho lamba. Kidney is okay. Liver is slightly echogenic. Gallbladder wall is poorly differentiated from the liver. Kidney on the left and the spleen, they are falling within the normal limit. No splenomegaly. हाँ बस ठीक साह लैके रोको ज़रा अंदर साह खिंचो रोक लो. This is the gallbladder. The wall is poorly differentiated. Suspected pericholecystic fluid, and this is the portal vein, and the portal vein diameter is 10.8. व्यूअर वीडियोस को लाइक करें, इसको सोशल मीडिया पे शेयर करें और चैनल को सब्सक्राइब करें. थैंक्स. चलिए ओके. 50-year-old female with huge abdominal pelvic ascites with small shrunken liver. Liver is only in the form of the remnant. Gallbladder contains stone. You can see the stone within the gallbladder and the pericholecystic fluid, edematous wall of the gallbladder. That is about 5.7. Normal is 3, up to 3. Huge splenomegaly, massive splenomegaly with distended blood vessels in the hilum. Spleen is 16.5 centimeter. This is the abdomen, this is the pelvis, huge abdominal pelvic ascites. Kidney on the left side is pushed and poorly visible. This is the kidney. On the right side appears to be kidney. On the left side, mild hydronephrosis is there. This is the left side.
Thanks for watching the video. Please like the video and share the video. Thanks.